Okay, after eons of attempted scheduling, I finally got to put together what I wanted to. I have a very special guest today who's going to introduce himself, and then we are going to be looking at more Fire Department Chronicles, but with a slightly different angle.
Hello, everybody. I am insert name here. I play Calix on Office TV. Yeah, this is my first time doing one of these videos, so please have mercy on me. I'm going to be completely honest. So that different angle that Office was talking about is I am a paramedic as my day job. I have not been a paramedic very long. I was informed that I should probably explain what the difference between a paramedic and an EMT is. And the simplest way that I can kind of explain it is the schooling for an EMT could be anywhere from 1 month to 3 months. For a paramedic, it's roughly about 16 months of rigorous study. In terms of like what we can do on scene versus EMTs versus is that we have a lot more access to medications. We have numerous more interventions we do. Typically with a cardiac monitor, if a service provides, you can pace someone, you can shock someone's heart back into the appropriate rhythm. You can give appropriate medications to help people breathe, among many, many other things. If I were to quantify it, I probably needed to know 80 different medications, even though I carry like maybe 30 different medications in my bag at any given time. If there's anything that's said during this video that calls upon my past experiences or treatment plans that I might have done, you can't really take that as fact or what every paramedic would do. Everybody treats medicine differently. Every state, pretty much every single town has different regulations on what their paramedics can do. So please take what I say with a grain of salt. If you had a past experience where a paramedic did this, that might have been the right call at the time. It really depends on the information about what's going on versus the actual knowledge that we obtain over time, because our protocols are like guidelines on how we should treat somebody, but the situation often is not textbook perfect. Things can get wonky on scene. Everybody kind of has their different view on the medicine. Granted, the protocols are very, very good about saying, hey, here's what you should do, but unfortunately, people's health and people's issues are never point blank or simple.
And because of this, I felt it was a really cool idea, now that he has been thoroughly, rigorously screened and trained, that, wow, important distinction, as with all videos, this is not medical advice. We did think it would be super cool if we could go through, there's a series that Fire Department and other people, Chronicles, do, where they green screen themselves into very schlocky medical shows like Chicago Fire and stuff like that. So I have gone through and I have curated several videos where EMTs and paramedics are called to scenes and that are notably hilariously misconstrued. And then typically Fire Department Chronicles adds in his 2 cents. I thought it'd be fun to almost tag team these subpar daytime shows while we will also give our 2 cents. And we can come from a direction of someone who knows to a degree the correct thing to do as opposed to what is done in the show, because even I, who am not an EMT or a paramedic, can typically tell you that they are doing several things wrong. And so that is what we'll be watching today.
All right, let's get these videos going. I'm kind of excited. I don't really watch too many of these, so
then let's get into it.
Well, that's a good.
How are her vitals?
BP's 81/42 and dropping fast.
She's hemorrhaging.
First off, that's called VTAC. You might want to fix that. Secondly, did you just tap on the screen hoping it would change the rhythm? Why are you touching patients?
Well, how much longer?
Okay, important clarifications. I want to see if I can get a screenshot of that monitor, because that is important. There we go. So first things first, and I can answer this one. Tapping on the screen does not change the number. If you do not like the number on the screen, tapping it does nothing. But you want to give a super brief description of what you're seeing?
Yeah, so right here we have someone who's in pretty much like textbook monomorphic VTAC. And for anybody who doesn't know, monomorphic So there are two types of VTAC. There's monomorphic and polymorphic. Subset of polymorphic VTAC is torsades de points, which is a whole other animal. But this, you see how like everything is like wide and kind of like looks like little points. Like each one of those is like a point of your heart, and that's where the entire ventricle is going. Normally with a QRS, you have like a P wave and then the whole QRS complex and everything. So VTAC is when it's just the QRS, which means your ventricles are going on their own. Usually this distinction is made by the amount of time it takes for the heart to beat. So with this one, the QRSs are wide, so you have those monomorphic VTAC all throughout. So the heart rate's 156, which is way too fast. For reference, if your heartbeat is like beating normally and for whatever reason you're not getting any electrical activity to like your sinus node and your ventricles pumping, the average rate is 40. So 156 is way too fast for just your ventricles pumping, and that blood pressure would actually make sense. I actually recognize that monitor. That is the LifePak, I believe the 15. You cannot quote me on that. That looks like a LifePak 15, which is what we used to use at my old job.
Would you say that any up to standard first responder should be able to look at what you're seeing on the screen right now and instantly recognize that as VTAC?
Oh, 100%. Like, okay. That's like, if I see that on the monitor, I'm like, oh, shit, that's a pucker moment.
If the person, better question, if the person saw that and didn't recognize it as VTAC, how concerned would you be? Because it seems like these guys didn't.
I would be very concerned, just based off of that really shitty situation. That is aggressive VTAC, and the heart should compensate for a little bit beforehand. But that blood pressure, I would 100% believe as accurate.
Well, we'll see what happens.
One thing I am noticing is, you see how there's all that dead space at the bottom of the screen?
Yeah.
There are so many other numbers that should be there.
They just edited it out?
Yeah, they just I don't know if they edited it, but you should like have an SpO2 probe on there or something else other than just the, hey, you have a heart rate and that NIBP or that blood
obviously
pressure.
The only thing that matters is blood pressure and heart rate. Everything else is completely irrelevant, obviously.
Yeah.
You don't need all those other numbers.
I wonder how much was cut out of this, because like getting that blood pressure cuff on some, I honestly probably would have extricated them. Again, I don't know what steps they had in the first 7 seconds.
We'll have to see if the I think this is Chicago Fire, if they say anything. But I wanted to get front load a bunch of the nerd stuff out. Now that we've got a baseline for what we're looking at, let's go from here.
First off, that's called VTAC. You might want to fix that. Secondly,
hemorrhaging, kind of obvious. If you weren't after this, I'd be surprised.
Why are you touching patients?
Well, how much longer?
The column isn't budging. Say 5-10 minutes.
Heartbeat's 140 and thready. She needs blood now.
Wait, what just happened? Wait, go back.
That heart rate completely changed, didn't
it? Sorry, I know he's about to say something right now about how it changed, but like...
Yeah, okay. So it has been a second, and those numbers are drastically different, and that heart rhythm is completely different.
Well, the issue is that's no longer VTAC right now. Like, I can kind of see a P waveform. I would definitely take a 12 lead to know, again, where are your other vitals, but like, Jesus Christ, that was a fast change. That blood pressure so fast.
Oh no,
I don't know how much you got out of the video.
Remember, she explained it. He's thready, which is somehow an answer to all questions.
Well, so okay, a little bit of insight. So that thready pulse that they always talk about in medical dramas, like, oh, he has a thready pulse. That's when they're trying to feel it on like either the radius or maybe even the what's it called? The ones by your neck. I'm absolutely blanking. I'm so
with the jugular or like.
Yes, jugular. And like you can barely feel a pulse. That's a thready pulse, where it's like it's normally you're able to feel it like no problem. Thready is like you can it honestly feels like threads. In the times where I felt it, it's like you can feel it slipping away and getting weaker and weaker, and it just feels like almost brushing against your skin.
Oh, geez.
When you're like feeling for a pulse, and that's when your blood pressure is so low, like this 71/36. That's definitely concerning, because like the perfusing pressure that you really want is like 65 to 75 is an ideal situation. Like this is a 47 I would hazard to even feel a pulse at that point. Like, there's a good chance that, like, you're not even going to feel anything with 71 or 36. Some people maybe, but, like, I would definitely think that's a thready pulse at least.
It does certainly make sense, seeing as they apparently slammed into and got wedged under a tractor trailer. So hopefully they could do something about that. Probably a good first step is getting them out from under the tractor trailer, if I had to guess.
I agree, but even if somebody slammed underneath a tractor trailer, depending on you're slammed, like, that thing's doing a great job of holding if you're bisected. You know what I mean?
And hopefully they aren't. This fake person, hopefully they aren't, but let's see what happens.
Ready. She needs blood now.
No, she needs someone in the back that can properly identify.
Yeah, I would definitely say don't give her blood if she's still bleeding, right? Because then it just is going to go out.
I'm typo.
Wait, what did he say? Sorry, we completely missed it. I'm sorry.
Oh, yeah. He basically said, he's like, oh, he needs competent people to work on her as opposed to these guys because it's taking them forever to do shit and they don't know what they're doing. But, I mean, that's the joke, right? For these shows. They act like they know what they're doing, but they clearly don't.
That means I'm a universal donor. I can donate to anybody, right? Get the transfusion kit.
Kat, you're not seriously thinking of doing a person-to-person. I mean, protocols.
If we follow protocol, she's gonna be gone before we get her out of this car.
No, I agree with her. It's always good to pump one person's blood into another person before you figure out where that pesky bleed is. And I mean, at this rate, by the time they finish extricating her, they won't have to worry about saving either of them.
Now,
honestly,
I mean, the first things I'm thinking of, right? Bloodborne illnesses. So you could potentially open yourself up to a lawsuit. Like, if that, even if she is O negative and you take her word for it, and she's not lying for some reason, or she didn't misremember, she could give some type of bloodborne disease to this person, especially if it's something like HIV or AIDS. That's like a huge thing. So I could definitely see people getting sued over that. And then also, don't you carry blood on the ambulance?
So, special services do carry blood on their ambulances. And by special, I mean as long as it's been approved by whoever's med control it is. And they carry, like, O negative blood. My service doesn't carry it, so I do apologize if you get some of this information wrong. But they carry the universal donor blood, and they can give it. That blood has been screened rigorously. But even though that does happen, one of the main concerns that we have with giving blood in the field versus, like, in the hospital, anywhere, is you can have something called a transfusion reaction, where essentially your body rejects that blood, and you have an allergic reaction all throughout your body. Like, let's say that this person, like, they don't even have a transfusion reaction. Like, depending on how long the extrication even takes, like, you're not going to have enough blood for both people, especially if you're bleeding out through, like, your GIs. Like, if you, like, have a massive internal bleed, that blood's really not going to do anything. But in addition to all of the risks, like disease versus transfusion reaction versus X, Y, and Z, there are so many things that can go wrong.
Can you think of any reasonable circumstance where you could think of something as out of the box as this being, like, approved by a superior on scene? Or is this one of those things where it's better to wait for, like, a specialized service or wait for the extrication people to come in? Or is there ever a timing where you think you would see this happen reasonably? Or is this a made-for-TV moment?
This is definitely a made-for-TV moment. At absolute worst-case scenario, if I had this situation, I would probably run, like, lactated ringers, which is, think of normal saline lactated ringers.
Yeah.
I'm not going to get into the pharmacology.
You can Google it. Google it if you're interested.
Lactated ringers is like a better version of normal saline. That way it doesn't change the pH in the blood so much without getting too into the science of it. But I would probably hang, like, a small amount of lactated ringers just to person get to the where, like, somebody with blood could arrive on. Blood is maybe at max unless you're in areas like 30 to 45 away. You know what I mean? Like, you just have to have them hold on. And at worst case scenario, you can pump on their chest and do traumatic CPR, which is less than ideal, but it's better than a random blood transfusion.
Yeah. With some person who I guess maybe was in the car, they're wearing, like, a trauma blanket, but who knows? Let's see how this works out.
They are a universal donor.
There's almost nothing from the driver.
Come on, Tina. Damn it.
Wait, I got a nut tick. Yeah!
We're back to
VTAC.
Back to VTAC.
Celebration if she stays in that rhythm much longer.
Yep.
Hey, that should do it, Cap.
Still not out of the car, by the way.
Color, let's get her out of there.
Incredible. incredible work, guys.
Okay, do you want to give a super brief explanation of like what a C collar is and why they're putting it on her?
So a C collar is abbreviated term for a cervical collar, and it's to prevent any further injury to the C spine. So your your vertebrae in your neck. Are you familiar with that or
I
no?
am
Just
aware.
so I can.
I am aware, but for the audience at home, the vertebrae in your neck are those things in your neck that you can feel with your finger if you put them on the back of your neck.
So you basically have 7 of those. So number 1 and 2 are your atlas and axis. They're kind of how you move your head, like atlas up and down, axis. C3 through C7 have their own jobs as well. It's more structure, but that's where all of your like nerves and everything run through. So if somebody's in a very traumatic accident, C card as a way to stop them from moving their head, so that way they can it minimizes the risk of damage. A lot of the medicine on C collar is debated. A lot of people hate C collars. But one thing I can tell you is every single patient hates a C collar because it is very uncomfortable. But it is definitely necessary to like keep them from moving their head.
You're weighing permanent paralysis versus comfort. Generally, I err on the side of minimizing damage to that thing that keeps me mobile in 4 limbs.
I would agree.
Generally.
My patients in the past would say otherwise, though.
They were
like I've had.
Yeah, it's traumatic, It happens. People get a little kooky sometimes.
Sorry, a little bit of a story time. You could cut this out or not. It's up to you. But like, I've had patients who have fallen, hit their heads, or have been in like major car accidents. Like they're out cold, and we put the C collar on them. We get them loaded in the back, and halfway through hot transport to the hospital, they've woken up like, "Hey, can you take this collar off my neck?" "Hi, what's your name?" "My name is Calix. Nice to meet you." Like, it's like the first thing out of their mouth. Like, where am I? Who am I? Wow, this is uncomfortable. Can you take it off? Is usually how it goes.
And since this is story time, I want to interject with a very important question I know the audience is begging to ask. Do you get to drive it? And if so, what does it feel like driving with the lights on? The ambulance.
Well, yeah, so I don't know how others...
Because I think we've all fantasized about being able to turn on lights and just dodge traffic and go as fast as we want. And also, yeah, you're saving someone's life or whatever, but just imagine how fun it is.
Yeah, so if we have to go lights and sirens, I'm usually the one in the back, so I don't get to drive. That's usually my EMT partner. But on the way to calls, if it's my turn to drive, then I get to drive. I used to be an EMT, so I've driven hot from emergencies before, and it's fun, but man, there are some interesting drivers out there.
Yeah. Well,
so
they
really
take the lights and sirens as a challenge, obviously. They're like, I can make it.
Like, I've been in a car accident before while going lights and sirens to a car. I cleared the intersection as I should, so there are rules you have to follow as driving hot. So, like, I went up the left lane, right over a crest of a hill. I looked left, it was clear. I looked right, it was clear, so I started to and I got about halfway through, and then we got absolutely T-boned by a car who was going like 40 miles an hour.
Jesus.
Like, well, like, yeah, it's cool you can drive lights and sirens, whatever. There are so many other risks associated with it that it's not worth it. Like, even if I have a really, really shitty call, unless it's like a cardiac arrest or a pediatric call, I'm like, hey, just take it slow, cold. Please just get us there in one piece is all I ask.
Yeah. Had to ask. Let's see how this wraps up.
A mind-numbingly stupid field blood transfusion. The fact that she's been an unrecognized VTAC for the last 40 minutes, and the longest extrication in human history. We're all gonna feel like we're a part of the fire department's version of Oprah. You're getting fired. You're getting fired. We're all getting fired.
I mean, I could definitely see some terminate. I mean, like I said, I don't know the book, right? But I could definitely see the attempt at what they were going for in terms of like if this was a real life situation. But there are just so many ways that even I could recognize that they fell short if these were real people. Obviously it's a TV show. That someone's losing their job, right? Like probably the guy in charge for not stopping any of the underlings from the series of missteps that they took and not doing anything. He just stood there the whole time. He didn't even help. And then moving on to the next one. Oh, God.
Heart rate is racing, his skin is cold and clammy. He's going into hypovolemic shock.
This happened like 6 seconds ago. That's the
Yeah.
fastest onset of hypovolemic shock that I've ever seen.
He's lost
So first things first, it looks like he got his hand caught in like a grinder or like some type of wood chipper or something.
Yeah, it looks like farm equipment. I can't
Could be some
tell
type
what
of
it is.
miller.
We go back to
Something like a tractor, maybe.
something like I can't even tell what that is, to be honest, because like a wood chipper would have like some kind of distance from the ground. You know,
Yeah,
it looks like
yeah. It looks like some type of like milling equipment or farm equipment. Yeah, and it looked like it got his arm. I mean, not the whole arm, but a good chunk of the arm. And then it looks like, according to the paramedic, he went into shock effectively instantly. And at some point, they
Great.
put a mask on him.
I wonder if he's in VTAC.
I don't know. Maybe we'll find out.
Seconds ago. That's the fastest onset of hypovolemic shock that I've ever seen.
He's lost consciousness.
I got the bags.
Yeah, he's going into shock.
How many
Again.
times is this guy going to go into shock?
How long until he's free? We need to get him stable.
Is now, for clarity, when you see someone use the term shock is not a catch-all term, right? There are sub factors of like causes of shock and applications and onsets, or is shock a catch-all term?
So shock, I wouldn't say it's a catch-all term. It's an umbrella term. There are so many different types of shock. There's like neurogenic shock, hypovolemic shock. I'm blanking right now. There's hypovolemic, cardiogenic, obstructive, and distributive shock. And then there are other types of shock that you can get into, and that's one of the categories about septic shock.
Yeah.
And then there's neurogenic shock, and then there's like pulmonary shock, or I think it's more known as like anaphylactic shock.
Yeah.
You know what I mean?
Yeah. Static shock, that was on CW.
Yes, but the main four are like hypovolemic, cardiogenic, obstructive, and distributive shocks.
And now
Those are like
it seems like they diagnosed hypovolemic effectively instantly.
yes.
Is that, first of all, given the method of injury, is that reasonable? And B,
100%.
given the timetable, is that reasonable? To get
because
that
it was-
information that quickly.
Because it was the arm, I would be hesitant to say it, but we haven't seen that VTAC or so I wouldn't.
Well,
Like
yeah,
that was a joke.
yeah,
Like,
we'll
we wouldn't
have-
be in VTAC.
Yeah, we'll have to
But,
see if
like-
they show the monitor. I don't know. They haven't shown it yet.
Yeah, so what we use to identify shock is like what we call a shock index. So that is like the heart rate divided by the systolic blood pressure. And if the heart rate is ever over the systolic blood pressure, you are in shock. So what I mean by that is if your heart rate is 120 and your blood pressure is 100, you are in shock. That's just how it is.
It's
that
a
means-
mathematical formula. If yes, then this. If no, then this. Like if the numbers lie out, then it is. It's a yes or no.
Exactly. So, like, if the heart rate is over the blood pressure, that's shock. Is the easiest way to think about it.
And let's see if they give us
5
more
to 10
numbers.
minutes, maybe more.
Can he last that long? There's no room to properly tourniquet. He keeps losing blood.
Well, there's your problem. We don't tourniquet wounds, we tourniquet limbs. And I'm pretty sure he's still got a whole lot of arm to play with there.
Be in there. It's too
Now, even I know that one. You don't tourniquet wounds, you tourniquet limbs. And typically, if I'm not mistaken, they say not to, like if they show it in movies, you're not supposed to use like your belt. You're typically supposed to use like an actual tourniquet. You could buy them online or at stores. And also, you're supposed to tourniquet above the nearest joint, right? So like his hand is caught in the thing, so you're supposed to go above his elbow and get it as tight as you can. If I'm not mistaken, if you're not a medic
Correct.
and you're waiting for medical attention.
Absolutely correct. So, a common rule for, like, tactical scenarios or even regular health scenarios, if you want to think about it that way, is that you want to go high and tight. So, if you get on your calf, you can go all the way up to the thigh. If you want to go, like, right above, like, the knee, like 2 to 3 inches above it, that's also ideal. You can but high and tight is generally the rule most people use. By definition, you should tourniquet like 3 inches. I think it's like 2 or 3 inches above the wound. But most people just go high and tight and clamp down as fast and as hard as you can. And a belt really can't get the amount of pressure you need in order to stop like major bleeds.
So would you say it's better in that case, like if your options are like a belt, would it be better to like rip your shirt up and then like twist it up and then get like a stick and kind of like wrench it as tight as you can and then tie the stick off if you had
That
absolutely
would
nothing. Like
that
Boy
would be
Scout style.
honestly better. Yeah, Boy
That's what,
Scout style.
that's what they teach in
100%.
Boy Scouts. They're like, get a stick, wrap it as tight as you can get it. Doesn't matter if they scream. Screaming means they're alive. And then as soon as you get it as physically tight as you could twist it, you take the rest of the shirt and you tie it so that the stick stays in place. And that's what you're supposed to do.
You want it to go tight enough where it stops the bleeding. Like, with major bleeds, you're going to know when the bleeding stops. Trust me.